You are dispatched to the home of an elderly male patient who's complaining of chest pain. You can start whenever you're ready.
Okay, first I'm going to take my standard precautions. Is my scene safe?
Your scene is safe.
Okay. According to dispatch, it sounds like I have one patient. It sounds like it is the nature of illness. I am going to consider the need for additional resources and call ALS at this time. I am also going to defer C-spine. Going in and forming my general impression, I do see that elderly male. He's sitting upright, appears to be clutching at his chest. Are there any immediate life threats?
There are not.
Okay. Now I'm going to go in and introduce myself as well as get my patient's level of consciousness. Hi, sir. My name is Brie. I'm an EMT. I'm here to help you out today. What is your name?
Tim.
Hi, Tim. Nice to meet you. Where are we at?
My house.
Okay. And can you tell me what year it is?
2026.
And why did you call us out here today, Tim?
My chest really hurts.
Your chest hurts? Okay. So based off that, I would say that my patient's chief complaint is some chest pain. I would say that they are A&O ×3 as they're able to answer all of my questions. I would also say that their airway is patent due to the fact that he is speaking to me in full and complete sentences. But I do want to assess his breathing. I want to assess rate and tidal volume.
Okay, they're both adequate.
Adequate. And I'm going to apply SpO2.
87%.
Okay. So because the SpO2 is reading 87%, I am going to apply some oxygen via nasal cannula at 2 liters per minute. Just breathe normally for me, sir.
Okay.
Does my patient accept oxygen?
Yes.
Okay. Now moving into my circulation, first I'm going to start by checking if there's any major bleeding.
You don't see any.
And then I'm going to get my patient's radial pulse.
Weak and rapid.
And skin signs, color, temperature, condition, and a capillary refill.
Pale, cool, diaphoretic, cap refills delayed.
Okay. Because there's an alteration in my ABCs, my patient's pale, cool, diaphoretic, their SpO2 is at 87% on room air, I'm going to consider them a priority patient. I'm going to expedite transport.
Okay. Okay, you're in the back of the ambulance.
Okay, so I'm going to begin my history taking at this time, starting with OPQRST. I'm going to ask my patient a couple questions. Sir, when your chest started hurting, did it come on sudden or gradual?
Gradually.
Okay. Does anything make it better or worse?
Not really.
And can you maybe describe the chest pain you're feeling to me?
It feels like there's an elephant sitting on my chest.
An elephant? Okay, and does that pain go anywhere?
It radiates to my left arm and a little bit to my jaw.
Okay, and then can you point directly where your pain is?
Right here.
In the center of your chest? Okay. And can you rate that pain on a scale from 1 to 10, 1 being minimal pain, 10 being the worst pain you've ever experienced?
Probably an 8.
An 8 out of 10? Okay. And how long ago did this chest pain start?
About 20 minutes ago.
And does it come and go? Is it pretty constant?
It's pretty constant.
Okay. And are you dizzy at all or maybe lightheaded?
No.
Maybe short of breath?
A little short of breath.
A little short of breath? Okay. Do you have any allergies?
No.
Okay. Do you take any medications?
Yes, I'm prescribed aspirin and nitro.
Okay, and did you take those medications today?
Yes, I took my aspirin this morning because I take it every day, and then I took my nitro when my chest pain started hurting.
Okay, and how much aspirin do you take every day?
81 milligrams.
81 milligrams. And do you have any past pertinent medical history, anything similar to this or related to this?
Yes, I had a heart attack a year ago.
Okay. And last thing you ate?
I ate breakfast and coffee this morning a couple hours ago.
Okay. And so you said you had a heart attack about a year ago. Can you maybe tell me a little bit more about that? What happened? How they treated you?
I went to the hospital and they prescribed me my nitro and my aspirin.
Okay, they prescribed you nitro and aspirin. And so what were you doing when this actually started, this chest pain started?
I was just sitting here watching TV.
Okay, so let me run this back to you, make sure I have everything straight. You were sitting watching TV when your chest pain came on gradually. It's in the center of your chest. It goes down into your left arm and into your jaw. You've had a similar episode to this in the past. It feels similar to what's going on today. And you are also prescribed aspirin and nitroglycerin, which you did take today. You took one 81 milligram tablet, which is your daily dose of aspirin. And then you also took 1 tablet of nitro today.
Yes.
Okay, perfect. And now I'm going to go in and inspect, palpate, and auscultate. First, I'm going to ask my patient, sir, is it okay if I lift up your shirt and inspect your chest?
Sure.
Okay. So I'm going to lift my patient's shirt up here. I'm inspecting the chest for any scarring, maybe implanted devices, accessory muscle use.
You don't see anything?
Nothing? Okay. I'm also going to check my patient's neck here for any JVD.
You don't see any?
And then I'm going to check the limbs, arms, and legs for any edema.
You don't see any?
Okay. I'm also going to palpate my patient's chest at this time to see if that changes their pain at all. So I'm going to ask my patient, sir, can you sit up for me, please?
Yes.
Okay. So I'm going to palpate the anterior and posterior chest, squeezing in, asking my patient, sir, does this change your pain at all?
No.
Okay. And then I'm also going to palpate the sides, asking the patient, sir, does this change your pain at all?
No.
Next, I'm going to auscultate. I'm going to auscultate at the second intercostal space, mid-clavicular, fourth or fifth intercostal space, mid-axillary. Then I'm going to ask my patient, sir, can you sit up again one more time for me?
Yes.
And then I'm going to auscultate on the inferior angle of the scapula, auscultating bilaterally.
Okay, you hear crackles.
Crackles. Okay, and so can I get some vital signs as well? I want my blood pressure, my pulse, my respiratory rate and quality, updated SpO2 reading, skin signs, color, temperature, condition, and then pupils.
Yep, there you go.
Thank you. Now that I have my vitals, I'm going to go in and form my field impression. I have an elderly male here who's experiencing some chest pain that I believe to be of cardiac origin. So I'm going to move into my interventions. Per County of San Diego Protocol S126, I can help a patient administer their own prescribed aspirin and nitroglycerin. So I'm going to begin with nitroglycerin. Nitroglycerin has a couple contraindications. So 1, the pulse must be between 50 and 100 beats per minute. If it is below 50 beats per minute or above 100 beats per minute, I cannot administer the medication. The systolic blood pressure also has to be 100 or above per County of San Diego. And then for National Registry, it has to be 90 or above. I also have to ask my patient if he's taken any sort of erectile dysfunction medications or pulmonary hypertension medications. So I'm going to ask my patient, hey sir, have you taken any erectile dysfunction medications in the last 48 hours, such as Viagra, Cialis, Levitra?
No.
Okay, and have you taken any pulmonary hypertension medications, or are you prescribed any pulmonary hypertension medications, such as Revasio, Floan, or Velitri?
No.
No, okay. So because my patient does not meet any of the contraindications, I can administer the nitroglycerin. So I'm going to go into my 5 rights. This is the right patient. It is his prescribed nitroglycerin. The right medication, it's nitroglycerin. It's a vasodilator, so it's going to decrease the workload on the heart. The right dose is 0.4 milligrams. Per County of San Diego Protocol S126, I can administer up to 3 doses, including the doses the patient has already taken. So I am going to again confirm with my patient that he only took 1 dose of nitro today. Sir, so you told me earlier that you took 1 dose of your nitroglycerin today, is that correct?
Yes.
You did not take any more?
No.
Okay, so I can administer up to 2 doses, but I am going to start with 1. So I'm also going to check right route. It's sublingual, under the tongue. Do not chew, do not swallow, just let it dissolve. And the right time, it's not expired. I'm going to check this with my partner, and then I'm going to triple check all these 5 rights again, and now I can administer the medication. I'm going to open the cap, tap 1 tablet out into the cap, place the tablet in my patient's hand, and instruct my patient, sir, can you put this tablet under your tongue, do not chew, do not swallow, just let it dissolve.
Okay.
And then I'm going to move into my aspirin. So there are no contraindications to aspirin other than an allergy, which we've ruled out in the history taking. So I'm going to go into my 5 rights. This is the right patient. It's his prescribed aspirin. The right medication, it's aspirin. It's an antiplatelet aggregate. The right dose is going to be my patient's daily dose, which I will ask my patient, sir, so you told me you took 1 tablet of aspirin today, so 1 81 milligram tablet is your daily dose. Is that correct?
Yes.
Okay. I can administer up to 325 milligrams of aspirin per county protocol, but I am only going to administer my patient's daily dose. Right route is going to be orally, chew and swallow, and then right time, not expired, double checking this with my partner, triple checking all these 5 rights again, and then I'm going to go ahead and administer the medication. Again, tapping 1 tablet out into the cap, and then I'm going to put this in my patient's hand, and then I'm going to tell my patient, sir, can you put this in your mouth, chew and swallow, please?
Okay.
Okay, now I'm going to reassess my patient, reassessing LOC, GCS, ABCs, updated vitals. I'm also going to ask my patient to re-rate their chest pain on a scale from 1 to 10 again. Sir, can you maybe rate your chest pain again on a scale from 1 to 10, 1 being none really at all, 10 being the worst chest pain you've ever experienced?
Probably like a 7.
A 7? Okay. And I'm going to reassess this patient every 5 minutes because they're an unstable patient on the way to the hospital.
Okay, you're at the hospital. I'm the nurse.
Okay, so I'm going to provide my turnover report to the nurse, telling the nurse, hey nurse, I have an elderly male here. We found him today at his private residence complaining of some chest pain. When we found him, he was watching TV. We found him with an SpO2 reading of 87%, so which we applied a nasal cannula at 2 liters per minute. He did tell us that he had an episode similar to this in the past. He had a heart attack about a year ago. He is prescribed aspirin and nitroglycerin, which he did take 1 81 milligram tablet of aspirin today, as well as 1 tablet of nitro before our arrival. We did help him administer the aspirin and the nitroglycerin. We administered 1 0.4 milligram tablet of nitro, as well as 1 81 milligram tablet of aspirin. Patient said that his pain went from an 8 out of 10 to a 7 out of 10. Is there anything else I can get you?
Nope, that's it. Thank you.